very pleased to have this opportunity to talk about United Way of the Cape Fear area, which does serve Brunswick County, New Hanover, Pender counties, and most of Columbus counties. Very proud this year we'll be celebrating coming up our 75th anniversary in over a time of which we've raised $70 million, or in today's dollars about $179 million, with the generous support of citizens in all 4 of those counties.
Every now and then, all of us takes a little dip, and we need someone there, or a neighbor, to come and say, you know what, I see where you are, and I can give you a helping hand.
Who do you help, and when do you help? The need well exceeds what people realize, what the average citizen thinks funding is going to. They're seeing just a microcosm of the greater need.
We will always have challenges, and what I see United Way doing is really rising to the challenge to address those needs.
And I think United Way did an excellent thing when they created those impact community visioning councils. And they created them out of people out of the community so that they could see what was going on in the community, could see what was needed.
And what I love about United Way is, as we've moved to the community impact model, it's adapting to the changing needs of our community.
There are certainly programs out there that are far superior now to where they were several years ago. Part of it is the coaching from the staff and the assistants and figuring out how to manage these processes, and part of it is the funding that they've been able to count on.
Not only do I get the funds, but now I get access to all that great expertise and knowledge that can help me and help our agency, and in the long run, help our local government, help our county just be able to thrive and survive.
We can change a community and allow them to bring in the experts and the expertise to really make a difference and an impact.
We have so many designated contributions, so when designations come in, we're told that the funds have to go to a particular agency. And that agency may or may not even put in a request for funding in a particular year, but yet the funds still have to go to that agency. If we had those designated funds as part of a general fund that we could allocate, we would be able to fund perhaps all of the requests. But if not all of the requests, at least far more than we have.
If you allow us to combine your funds with those of others in the community, we can change a program, and the results that we expect from the agencies that are providing services in our community are monitored, tracked, and shared with the community at large.
You know, it comes from our community, it flows through the United Way, and they're able to laser point and direct that funding to have the greatest impact.
The United Way funding doesn't just help them pay for a program, but it helps them leverage themselves to get other funding.
When you get ready to go out to have funding from other agencies, they want to know, has your community funded you? And it's easily to say, I'm a United Way recipient.
Every single proposal that comes in is a great proposal for a valid reason, for a legitimate program that needs funding, and we don't have the funds.
It is quite overwhelming when you really see the need in our community, as well as understand the outcomes that they're trying to achieve.
We need to bring in more dollars. This community can support it. There's no doubt in my mind that this community can support it.
$10 combined with $10 from 100 other people allow you to implement programs in our community that change lives. And I mean really change lives. It can take people from poverty to prosperity.
And that $10 or $20 a week that you gave 5 years ago is a child walking across the stage and graduating now. And then all of a sudden, you see the impact.
United Way of the Cape Fear area serves Brunswick County in many capacities. We work with Matthews Ministries to help feed children. We work with Brunswick Family Assistance to help families live more self-sufficient lives, with New Hope Clinic to make sure that everyone has an opportunity to live a healthy life. And we work with communities and schools of Brunswick County to make sure that children are growing up educated and able to join the workforce.
What we try to do is determine what programs we can give support to that are going to increase level of indicators that show improvement in our community. We have a collaborative effort between Good Shepherd Center, the Wilmington Interfaith Hospitality Network, as well as the Phoenix Employment Ministry, called the Homeless Intervention and Transition to Independence. What these nonprofits are able to do by working together is come up with creative solutions for people to find jobs, find places to live that they couldn't do on their own.
When me and my wife first showed up here, she was carrying a backpack full of diapers, 8 3/4 months pregnant. We had like $40 in our pocket, and I had our clothes split in half between, and now we're in our own apartment. You know, got the bank accounts back and slowly working on progressing. Part of my process of working with Interfaith was that I also got to work with Phoenix Ministries, who took the time to, give me training. And I had no concepts before writing a resume or anything like that. I was kind of brought up in an old school way, come in, shake the man's hand, ask him for a job, sell yourself. I got put out when I was a 15-year-old kid. I learned, get it for yourself. The next man isn't all that important. I had to open myself up and not be as guarded, because part of Phoenix is you find something, let's bring it to the table, let's talk about it. Maybe it may not help you out, but it might help 2-3 other people out. I went through a phase of where I would be guarded because, wait a minute, I brought up this fact that they're having this interview here. Now I'm competing with 3 people that were at the same table, but I was just getting myself twisted up and wound up over $7-8 an hour jobs. And now, I work for a place where I make closer to $11 an hour, and I get the benefit of medical insurance for me, my wife, and my son. I had to learn, to open myself up and allow Liz to help me, allow Ann to help me, allow Don Skinner to help me. That bullheaded, I can get it, I can do it my way. When that stopped, everything started to fall in place.
If it wasn't for our donors giving to the United Way's Community Impact Fund, the United Way wouldn't be able to encourage these types of collaborations that provide innovative solutions to the problems in our community. Programs that are awarded United Way funds have a balance of intervention and prevention, so that we're not just bailing people out, but we're giving them the tools that they need in order to be successful in the future.
In the United Way of the Cape Fear area region, our services and community impact is not restricted by county lines. For example, if a family needs the Salvation Army or the Red Cross and they happen to live in Brunswick County, then we support services that will come out to Brunswick County or Pender County or Columbus County, even if the services don't reside there.
What Community Impact does is the United Way is able to bring in a program that gave probably half a dozen to a dozen health and human service agencies in the area over $3 million. That money would never have been able to come into our community if it wasn't for the United Way's controls and checks and balances. So that's another reason why it's important to continue contributing to our local United Way. The funds that you give are able to be used to attract funds that wouldn't come otherwise.
My name is Margaret. My first job out of college, one of my duties was to organize the United Way Drive. From there, I started in advertising as a secretary, retired as a vice president. It was wonderful. Worked very hard for very many years. And now at 64, I find myself unemployed, uninsured, and living completely on Social Security. I never expected it to happen to me. I thought I was a very good planner, and yet here I find myself. I'll be 65, at which point I'm eligible for Medicare. Cape Fear Health Net has just bridged the gap for me in the meantime. And I have had health issues in the last year, and they've been here for me and wonderful and respectful and courteous and competent. And they're just a wonderful organization, and I'm very thankful for them. You're not helping some nameless, faceless people who don't want to do something different. You're helping your neighbors. You could eventually be helping yourselves.
I'm Jessica Green. I am the supervisor of the Rape Crisis Center of Coastal Horizon Center Incorporated, and I am working with the Regional Domestic and Sexual Violence Victim Mental Health Service Project funded through the United Way Community Impact Fund. In this initiative, we are able to have a collaborative effort with other programs, and we are able to provide services that will have a far greater impact than any one program can provide. People were not getting the services that they needed. They were experiencing depression symptoms, PTSD, they were having trouble functioning in work life and family life, and if this program were to not be available, I'm afraid that we wouldn't be able to offer this any longer. And this is something that to all the programs who are involved in this, that this is crucial, and we believe in this project. We believe that it is important to our communities that we serve, and we believe that the survivors that we work with every day benefit from this time and time again. Something that has come out of this project that I think that we didn't really expect is that we are collaborating at a much deeper level than we ever expected. We're able to share information about trends that we're noticing, issues that our survivors are seeing. And with the funding that we've received, we've been able to do a lot. We've been able to serve 365 people last year. And we believe that if the Community Impact Fund was supported even more, that our impact could be even greater.
You know, unfortunately, we have much more need in this community than we're able to award the grants for. We probably expect to have 26 well-qualified grant requests, and we may only be able to fund 13 of them. We need to do a better job of getting into workplace campaigns and talking to individual donors that are willing to hear the United Way story. They need to learn about United Way. When you have someone like the United Way analyzing the indicators to find out where your money is going to do the best for the community, you feel much better about that. Once you volunteer or have some knowledge about what we're doing, you develop a level of trust because you know it's being evaluated objectively for the best of the community.
Our region has 6,000 United Way donors, and we're able to help over 130,000 people live self-sufficient and healthy lives.
In particular, we want to mention a couple significant county business-related campaigns that have been very supportive over the years. Those include Victaulic, Brunswick Community College, Brunswick County, the county schools, Duke Power. The power plant there has run an astounding campaign the last couple of years. Novant Health Services, Capital Power, and Archer Daniels Midland have been supporters over the years as well. And of course, probably one of our top campaigns in our whole area is ATMC.
My name's Billy Smith, and I'm a volunteer and donor for the United Way. And I think that one of the most important things for people that are considering giving money to the United Way is to realize the return on their investment through leverage. When we go to companies' workplace campaigns and ask people to donate a certain amount of money over a year, they have the ability to donate that money to the Community Impact Fund, which allows us to help our nonprofit agencies in the area come up with collaborative efforts that we can direct our money to. However, when someone designates their money through the United Way to a particular agency, we lose the ability to help people come up with creative and innovative collaborative efforts.
The communities and school site coordinators, the two that we have here, are phenomenal. They've taken students who are reluctant to speak to teachers, reluctant to build those relationships with administrators. And they've latched on to those two key people in their lives, and they've been able to be very successful here at Williston and really just grow into their potential. And I see that this partnership that we have with communities and schools is one that would be long-lasting and beneficial to all of the students that we have here in New Hanover County. Our partnership with the United Way allows us to go into schools and serve the kids who need us the most. Those students who are most at risk of dropping out due to lack of resources or academic supports that need to be in place for them to be successful in the classroom. I think it's important that students have those barriers removed so that teachers can actually teach them the information they need to know so that they can be successful in life. And through the United Way funding, our site coordinators that they support have been able to reach out into the community and find those partners that can bring in and broker those resources to help these students that have these myriad of obstacles to their education, whether it be food, clothing, school supplies, health screenings. These things are able to be in place for those students to help them focus in the classroom and not worry about where they're going to do their homework because they don't have electricity in their home.
Sometimes it's just as simple as to leverage those monies to be able to attract other foundations. And a perfect example of that is the backpack program, where the United Way gave $20,000 and the Walmart Foundation was able to give $75,000. We find that the backpack program significantly raises the indicators that are related to feeding hungry children so they can learn, and that decreases dropout rates and has many benefits for our community immediately and in the future.
Through our United Way collaborative with Dreams of Wilmington, Kids Making It, and Brigade Boys and Girls Club, we're able to partner together and share resources for the students that we serve inside the school and in after school. Our partnerships with our community agencies are so vital to the work that we do here because we only have one or two persons on the ground who are connected inside of the schools. So we need those partnerships to be strong and those passionate community partners who can come in and deliver the services to our students here in New Hanover County.
The way I look at it is when I give $1,000, the United Way is able to bring more money into the community that wouldn't have come in otherwise. So that's what leverage does for the United Way and the Cape Fear area.
The Community Impact Fund ensures that we're able to serve families no matter what the need in our 4-county region. If you're unaware of services that the Community Impact Fund provides in your county, please dial 211. It's the hotline for health and human services so that you can find programs that meet your family's needs.
There will always be needs. While the economy has improved, it really has not impacted many families. In this community, we still rely on a service industry primarily. We're fortunate to have a few new industries move into town that we see doing some hiring, but there's still a lot of families and needs, and it may not be economic related. It might be counseling related. It might be school performance related. So those are all needs that will continue to exist. And we try to impact areas that are going to change family and individuals' conditions. That's first and foremost for us to invest in a direct service program that we want to see lives changed so that they won't rely on those services in the future. Over the year, the agencies, those programs have to prove to us that they're having success. So we see outcomes on a quarterly, annual basis to show that they're accomplishing what they said they were going to do. The lack of sufficient resources in the community, both for United Way as an investor as well as the agencies that are providing their direct services, we have found that when you can leverage those limited resources, then you can multiply it 3, 4, sometimes 10 times. So for every dollar that is invested in some of these programs, you're getting a $10 return. And we have found that more and more of these direct service agencies really did not know what some of the other direct service agencies were doing in the community, and they discovered that they're working many times with the same clients, the same families, the same specific geographical areas in the community. And they came to realize that if they share their resources to address the needs in that particular area, it's like a puzzle. You put all the pieces of the puzzle together, you have a whole picture. And it really is kind of a holistic approach. So we've been extremely successful in this community, brokering those relationships, and we have seen some phenomenal results. I think the summer program at the Blue Ribbon Commission to Prevent Youth Violence, the BELL program, was a great example of the collaboration you see among agencies. Now this collaboration, it was both a private and public partnership because DC Virgo Academy was used as the campus. So those are public funds, that's a public entity. But Blue Ribbon Commission helped bring in a resource from the Charlotte area, again called the BELL program. And that initiative worked with some at-risk students and provided a 6-week program that helped enrich their education over the period of the summer, as well as provided them some growth opportunities in the arts, again, entrepreneur skills, took them on tours of places a lot of these kids had never been before. So it was a very, the enrichment aspect of it was just as important as the academic piece of the puzzle. Chronic homelessness has always been an issue here because of our geography and because of our climate. And we've seen through a number of collaboratives in this community, and is partly driven by the 10-year plan to end chronic homelessness. Based at United Way, we've seen a 70% reduction in chronic homelessness in this community in the last 5 years. And again, it's because every agency that deals with homelessness as an issue is bringing a resource to the table to help a homeless individual. So we have programs that are helping individuals apply for disability. We have organizations that are providing food and shelter to these individuals in the interim. We have supportive housing organizations in town. So you put all those resources together and you can deal with a critical issue like chronic homelessness.
United Way is definitely a local organization. It's trying to bring neighbors together to solve our own problems. When I first got involved with United Way some years ago, I found very much a family atmosphere. One of my first neighbors was actually an employer of United Way at that time, who helped me to really understand the sphere of influence locally here. Through the community impact process, I've learned and I've witnessed personally the staff at United Way taking a personal interest, really bringing it home and understanding the programs that are available in our community, and more than that, really understand what the needs are in our community. None of the programs in our community can exist in a vacuum. One of the things that we experience here, and as we really get to understand the needs in our community, is that they're very complex. Collaborating on programs to meet the full need of the person is extremely important.
We are still able to manage a process and an organization that is community-based. The money that is raised in our campaign here stays here in our community. Just over 1% actually leaves the community. The balance of it is raised here, it is banked here, and it is invested in in programs addressing the most critical needs as identified by citizens in those 4 counties. Dealing with some of the today's issues has been very important to United Way in our community. We have agencies, programs that we are funding directly in Brunswick County, also agencies that are in New Hanover County as well as Pender County that serve residents in multiple counties. And in our particular situation here, the money raised in Brunswick County, while it is significant, the investments we make in Brunswick County services for residents in Brunswick County actually exceed what we raise there. So again, it's another example of money raised staying at home.
Hi, I'm Bonnie Harris, and I just want to share a little of my story of how I felt the impact of United Way programs. United Way programs actually saved me from a really dark moment in life. I was 18. I was a mother of a 6-month-old. Didn't really have any income, didn't really know what to do or where to go from there. But the people that worked with me encouraged me to go back to school and encouraged me to further my education and encouraged me that as long as I have a will, there's a way. So now I'm able to give back. So it really took me from a moment of crisis to a moment of stability to where I'm able to give back. I remember a time when I had no diapers for my baby, and I was so embarrassed to tell anybody, but I told the lady that recruited me from United Way programs, and this lady was so wonderful. She showed up to my doorstep with a bag of food, a bag of diapers, formula, books, toys for my baby. They just really go above and beyond. They do everything they can, and they're all about the community. Another one of their programs was all about books, and it taught me how to read to my baby and how to make reading fun and how to make her enjoy reading. And now she's one of the top students in her class. She's 5 years old. She's in kindergarten this year. And her teachers love her because, she's a great student, but that was all from what I learned from the programs of how to teach her and how to get her interested in books and how to get her interested in learning.
I am community impact. As I was growing up, my father was the one to teach me about giving back, and especially in my own community. I used to designate 2 particular agencies, but after I started sitting on, as a volunteer on the investment teams, I learned that it's such a good process because they really take a look at what areas and agencies are going to make the most impact. And I discovered that when there was more collaboration, then there's less duplication of efforts amongst different agencies trying to do the same things, and just a more efficient use of the funds.
Hi, my name is Dustin Stream. I work at the Wilmington International Airport, and I am Community Impact. I've always known that United Way was a very important part of our community. As an employee of the airport, I've been giving for the last 10 years. But before I was on the investment team, I didn't really have a full understanding of what goes on. I give to the Community Impact Fund because as a member of the investment team, I've learned that the needs in the local community far outweigh the funds that we receive. But by getting all those funds collectively and being able to have them in the community fund, we're better able to distribute them and better match the need for the funding that we do have.
Because I love the program so much, they asked me to come be a part of the program. It's the best feeling to be able to give back and to be able to support your community the same way they supported you. And I think that's what a community is about, giving back. And to be able to help these girls that I used to be is the biggest blessing I could ever ask for.
For me, living united is just about sharing a little bit of what you have. I've seen how much we can do with just a few dollars. So those couple of dollars that comes out of your paycheck that you might ordinarily spend on a cup of coffee, we can take those $2 and the $2 from 100 other people and really make a difference in a community program.